Good afternoon, Ms. Brami.
Good afternoon, my lord. Our witness this afternoon is Ms. Kimberley Wong from the Coalition for Racial Equality and Rights, and her witness statement reference for the record is SCI WT 0920-501.
Thank you. Good afternoon, Ms. Wong.
Good afternoon.
Now, when you're ready, Ms. Brami.
Thank you, my lord. Good afternoon, Ms. Wong. Please could you begin by briefly outlining your role at the Coalition for Racial Equality and Rights and tell us a bit about the organisation's main mission, particularly as it relates to anti-racism and public policy in Scotland?
Absolutely. So the Coalition for Racial Equality and Rights, or SCRER, which I'll refer to it as, is a Scottish anti-racism charity based in Glasgow. We are focused on eliminating racial discrimination and harassment and promote racial justice across Scotland. And we do this through capacity building, research and campaigning activities which respond to the needs of Black and minority ethnic communities. And our work takes a strategic approach to tackle deep-rooted issues of racial inequality. And it can range from a lot of different things, from culture and heritage all the way through to criminal justice. And I should clarify that when I discuss anti-racism, we're talking about targeting actions at communities who have been adversely racialized. So no competent consideration of the impact of racial discrimination is possible without understanding the comparative positions of people negatively impacted by racialization, minority ethnic people facing barriers related to xenophobia or recent migration who are racialized as white. And it doesn't mean that we apply a colour bar by any sense, because we're not referring to skin colour. We refer to social processes which assign a racial identity linked to the protected characteristic of race as understood by the Equality Act 2010. CRER takes a rights-based approach. We promote relevant international, regional, and national human rights and equality conventions and legislation. And my role at CRER as the Public Affairs and Policy Officer is to contribute to the development and implementation of CRER's parliamentary and policy work streams and the wider work of the organisation, and to make sure that we have anti-racist perspectives and anti-racist actions embedded in public policy. And it means that we can work very closely with Scottish Government and Scottish Parliament to influence policy.
Thank you. Now, I want to ask you firstly about pre-pandemic preparedness and consultation. In paragraphs 9 and 10 of your statement, you say that CRER wasn't aware of any pandemic planning undertaken by the Scottish Government, wasn't consulted or invited to contribute to any planning for pandemics or other national emergencies. What would meaningful inclusion in such planning have looked like for your organisation?
So CRER by no means are experts on healthcare or national emergencies, but I would say it's an expectation that Scottish Government would meaningfully engage with adversely racialised communities when it comes to pandemic planning, as well as other marginalised groups who could be negatively impacted by the pandemic. And what this means for us as an organisation would be implementing recommendations from stakeholders and those who represent their interests as well, so that specific needs of these communities can be met.
And can you expand on the implications of the lack of consultation for CRER and the communities it serves?
Absolutely. So I think one of the very direct and obvious implications of having a lack of consultation would be that the specific needs of Black and minority ethnic communities are then not met. And what this has meant for them is that BME communities then take the brunt of the consequences from the pandemic. And for CRER, it also means that years of race equality expertise in policy is missed out. Even though consultation and research is key in developing any pre-pandemic planning for national emergencies, we can't forget about institutional memory. And BME communities are more likely to suffer from consultation fatigue, as consultation often involves bringing up experiences of racism, which can be traumatizing to relive. And repetition of such exercises can also be exhausting because it can lead to frustrations that nothing has been changed as a result of consultation. There's also an element of inaccessibility in government planning. Most people won't be well-versed in plans, and it's quite common that CRER has encountered these situations before. From the years of anti-racist campaigning, we have institutional memory of what works and what doesn't work in policy, and we can highlight the pros and cons of potential planning. Therefore, consultation with CRER and other bodies who may represent the interests of minority ethnic communities are keys to ensuring that there can be no gaps.
Thank you. I want to move on to the impact of the pandemic on CRER's operations. You state about halfway down paragraph 12 that CRER developed a communication system to enable needs relayed to us by grassroots organisations to be directed to service delivery organisations locally. Can you describe how that system worked in practice and its effectiveness in addressing needs?
Absolutely. So this system was in the form of a password-protected online portal. So it was only accessible by internal staff from CRER and the community planning partners in Glasgow, which include Glasgow City Council, NHS Greater Glasgow and Clyde, and Glasgow City Health and Social Care Partnership. Although I should say that I was not directly involved in the communication systems, so if there are any details about it, I can provide that information in writing after.
Okay, thank you. Are you able to tell us how your coordination with the Glasgow Voluntary Sector Race Equality Network assisted in identifying and responding to the needs of the Black and minority ethnic communities during the pandemic?
Of course. So the Glasgow Voluntary Sector for Race Equality Network, or we call it GVSREN, it was very key to CRER's work on a local level and still is to this day. It was very effective actually in getting the correct responses to the needs of BME communities. Network members were a primary source of information on the emerging needs that were coming up in the pandemic, and we were often able to connect them directly to colleagues in local service provisions in order to address the issues. And this was then logged onto the online portal so that other organisations who might need to know about it could then access the information and share it.
So you were able to relay urgent issues such as food accessibility, digital exclusion and funeral arrangements, I think. Were these issues escalated to or supported by public agencies at any point, and if so, how?
Yes, I believe that the network did escalate some instances to public authorities where it was appropriate. Many in the network were actually equality officers in public services, so they were directly able to put people in touch with the relevant bodies. And the speed and helpfulness of these responses to community needs at the time were something that CRER hadn't seen before.
Okay. In a positive manner? Or?
Yes, in a positive manner.
Now, I want to move on to the disproportionate impact on BME communities. In paragraph 18, you say that the COVID-19 pandemic had a disproportionate impact on BME communities and worsened health outcomes for people from BME backgrounds. Can you provide examples of how those disparities manifested in Scotland?
No, absolutely. So one of the most obvious ways that racial disparities manifested during the pandemic was definitely in the mortality rates of the coronavirus. So Black and minority ethnic groups were more likely to die from coronavirus than their white counterparts. Specifically from March 2020 to September 2021, it was reported that, for example, the Pakistani group were 3.7 times more likely than the white Scottish group to have a death involving COVID-19. And the same report wasn't able to mention other factors such as health or occupation, and they didn't have sufficient data to draw out conclusions for many other ethnic groups such as Bangladeshi or Black. But while we don't have this in writing, all of our former research at CRER can point to a combination of factors that can include socioeconomic disadvantage and pre-existing health inequalities. And by that, what I mean is health conditions which can be which can be a direct result of institutionalized racism. So, for example, data shows that South Asian people are more likely to be at risk of cardiovascular diseases, and studies then show that one of the potential risk factors of having a high risk of cardiovascular diseases for South Asian people is their exposure to stressful situations and events such as racism. And when such conditions are paired with a healthcare system that is not racially literate, it can mean that there's a higher risk of mortality. In other words, if healthcare systems don't take into account additional risk factors of specific ethnic groups and try to address the health inequalities, it means that they leave these BME groups more at risk of death. And it's important when we talk about disparities as well, we don't only talk about health inequalities, but I can speak to this in later questions as well.
Okay, thank you. Yes, because in your statement at paragraph 26, you say that it was only when reports from England began to surface that there was a conscious effort in Scotland to better collect ethnicity data. How did the lack of robust data collection affect the ability to monitor and address racial disparities early on in the pandemic?
So a lack of robust data collection, I would say, severely diminished Scottish Government's ability to respond to the pandemic. And one of the easiest ways to identify that is through mortality rates. So in our statement, we mentioned that this was not brought up until the UK mentioned it. And it's very clear to see that Scotland did not collect ethnicity data on infection or death rates before that. Our director was then able to write to Scottish Government ministers about this issue and request information in Scotland because it was not collected at the time. And it was only after continuous engagement that there was an effort to collect the data and then to be able to monitor how or which groups were disproportionately impacted by infection and mortality rates. But CRER believes that if ethnicity data were collected pre-pandemic, then it could have led to an immediate identification of racial disparities in mortality and infection. We always need more ethnicity data, and it's something that CRER has been campaigning for years. And the pandemic was just one instance where it showed that there can be dire consequences when we don't have adequate data. We can also point to other areas of racial disparity left unrecognized because of a lack of data. That can include things like racist bullying at schools. It can mean labour market inequalities and beyond. And this will continue to have negative impacts on BME groups in Scotland until they are addressed. Without understanding the problem itself in the form of data or other information, we're not able to tackle these root issues.
Thank you. I want to move on to structural factors and socioeconomic barriers, but I'm just reminded that we do have a stenographer who's transcribing, so if I could ask you to just slow down slightly. Thank you. Now, about halfway down paragraph 20, you note that BME people are overrepresented in overcrowding statistics, increasing the risk of infection, facing barriers to access to healthcare, and being more likely to be key workers exposed to the virus. Can you discuss the interplay of these factors on their and their impact on health outcomes, please?
This might be quite an obvious answer, but overcrowding basically just means that there is less space in one home or one household. And it can be quite common of many Asian families, and particularly those from a South Asian background, because they're more likely to live in intergenerational households. And again, what this means is that there are just more members of the family living in the same space. And what the close proximity of having so many people there in one space means that there's a higher risk of infection and higher risk of transmission to the virus. And as we said before, when this is paired with high numbers of Black and minority ethnic people working in frontline services such as healthcare, who are then more exposed to COVID-19, it means that in their households, more people will be at risk of infection and therefore more at risk of mortality rates as well.
Okay. And you also mentioned that there were pre-existing higher rates of poverty and insecure work among BME people. How did those factors exacerbate the impact of the pandemic?
So I'm a little bit confused about the question, but I think if it means how was poverty and insecure work worsened for Black and minority ethnic people during the pandemic, maybe I could answer that a bit more if that's what you mean.
So do you think having insecure employment worsened the impacts that people felt during the pandemic compared to someone, for example, who had secure, fixed hours of work every week or every month and who wasn't living in poverty? In what ways would those socioeconomic barriers make their experience worse?
No, absolutely. I think I understand a bit better now. So poverty rates for Black and minority ethnic people have always been disproportionately high across all the measures. So that means relative poverty, absolute poverty, material deprivation, and otherwise. And even now, Black and minority ethnic people are twice as likely as their white counterparts to be living in poverty. The three main drivers of poverty, as described by the Scottish Government, are cost of living, social security and employment, and all of these factors, I would say, could worsen outcomes for them during the pandemic. Research from CRER and data from the ONS shows that BME people are more likely to be unemployed, to be in insecure work, and to be overrepresented in low-pay sectors such as hospitality and retail. And both of these sectors, as we all know, were disproportionately impacted during lockdown, as workers were furloughed or made redundant. And this was not effectively... and this means that a lot of BME people were then left with no income, putting them at risk of poverty. And also, on the other hand, BME workers could also be in frontline services, so such as healthcare, as we discussed before. And again, this means that they're more exposed to the virus, and it means that they have worse health outcomes. And it should be noted that a lot of the barriers in employment disproportionately impacted BME women as well. So they were a group that had very little data collected on them at the time, but analysis of job retention schemes shows that BME women were more likely to be furloughed, and there was an added element of unpaid caring responsibilities, which was not reflected in labour market data as well.
Okay, thank you. Were any of these structural barriers raised with public authorities as areas requiring additional support or particular measures?
Yes. So I would say that structural racism in a few of these areas were definitely mentioned, and particularly through the expert reference group, which was created, I believe, in 2020. Mm-hmm. And Scottish Government were able to create action plans after consulting with organisations such as CRER to address the issues that we spoke about.
Thank you. I want to move on to discuss discrimination and hate crimes. In paragraphs 23 and 24 of your statement, you recount incidents of targeted misinformation against Roma and East and Southeast Asian communities, including waste management workers refusing to serve a neighbourhood. In one example, I have two questions about this. Firstly, were any formal accountability mechanisms triggered by these events, such as the refusal to collect refuse? And secondly, did CRER and partner organisations, how did CRER and partner organisations respond to this rise in hate crime and discrimination?
So for the first question, I unfortunately don't know the answer to that, whether there were formal accountability mechanisms. But I do believe that trade unions did get involved in this specific instance where refuse workers refused to provide that service to Roma communities. To the second question of how CRER responded to the rise in discrimination. If we go back to the specific instance with Roma communities, what specifically happened was that it was during a time where outdoor walks were permitted with members of only one household. So it means that when large families and people living in overcrowded housing from Roma communities went out for their walk, they were then falsely accused by commentators on social media that they were breaking social distancing requirements. This then extended to photographs being shared on social media of large outdoor events, and this was declared as proof. But it can now be conclusively shown that these photographs actually occurred before the pandemic. So these were false images being circulated with a deliberate aim to stir up hatred. CRER, unfortunately, does not provide services, so our role in dealing with this specific situation was somewhat limited. We wanted police to moderate and respond to the comments of these social media posts, or to take them down, or amend the post at least that we felt reinforced the belief that Roma groups in Govan Hill weren't social distancing. We don't believe that there was enough regulation and safeguarding in place to protect the communities. Police did not engage with the misinformation spread online and did not respond immediately to those who were raising concerns, i.e. CRER. And when we turn to look at East and Southeast Asian communities, I think similar comments can be made. For example, early on in the pandemic, there was misinformation about the cause of the coronavirus being Chinese people eating bats. And the virus was then also named the China virus. This incited a lot of hatred amongst people, which were directed at people from Asian backgrounds. And this also included things like boycotting Asian businesses and also resulted in physical violence as well.
Thank you. And I just want to briefly go back to your first answer. You said that the trade unions became involved with the issue of waste collection. Did the trade unions support the workers' refusal to collect waste, or did they become involved to oblige their members to collect waste?
Again, because I was not directly involved, I wouldn't be able to say for sure, but I believe that the trade unions were trying to make sure that the service was provided to the Roma communities.
Thank you. Now, you've mentioned that the police weren't engaging with the misinformation on their social media pages to dispel any false information, and they weren't very quick to interact with CRER. Other than responding more quickly, what do you think could have been done differently by the police and local authorities to address these issues?
I think in these instances, it's an issue of trust as well. Black and minority ethnic people and their relationship with the police, I feel like that event created a lot of distrust. And more work should have been done to build up that relationship. I think adversely racialized communities can share similar stories about police, whether that's pre or post-pandemic, so that's something that I think could have been done differently. And on another level, other than being quick to respond, bettering community cohesion. And what community cohesion means is to build stronger and more diverse communities who can empower one another. And work on this was lacking, and I feel if work was done beforehand to work on community cohesion, then that level of discrimination in the first place could have been reduced, and then appropriate responses could have been given quicker.
Thank you. I want to look a bit at consultation and engagement with the Scottish Government and other public agencies. In paragraphs 59 to 61, you describe CRER writing to the Minister for Older People and Equalities in May 2020 and subsequently being consulted in joint online meetings. How would you assess the timeliness and effectiveness of the Scottish Government's engagement with CRER and also other race equality organisations during the pandemic?
I would say Scottish Government's engagement with CRER was not timely. From CRER's perspective, the meetings with the Minister for Older People and Equalities at the time was only provided to us after we had written to a number of Scottish Government ministers and officials. And this was after we were made aware of the disproportionate impact that COVID was having on Black and minority ethnic people. So by then, there was already a massive time gap. Mm-hmm. Had we not taken initiatives ourselves as CRER, it's hard to say when Scottish Government would have engaged with race equality organisations through the pandemic. So in that sense, I would say the meetings and following engagement afterwards was not timely. We would have expected Scottish Government to have raised the issues themselves. Moreover, we only engaged with Scottish Government on an equalities basis, and we did not receive any written response from people we had written to through health and social care. But we do not believe that structural racism should be dealt with in isolation, and I think that this was a missed opportunity on Scottish Government's behalf. And at most, we had 2 or 3 meetings with the Minister, but there was limited engagement. And CRER feels that these meetings were done so that we felt heard rather than for them to take meaningful action immediately. And it was only after the expert reference group was established that there was then issues of health brought in, and on a wider scale, structural racism. So it involved into a larger action plan because there was more public pressure at the time.
Thank you. And I think CRER was part of the expert reference group on COVID-19. Do you recall what CRER's key recommendations were, and do you consider that they were sufficiently acted upon by the Scottish Government?
So with the first part of the question, what CRER's key recommendations are, I would say all of the recommendations on the ERG were fully supported by CRER, and we do still see them as a priority. The ERG actually had 2 sets of recommendations, as I said. The first were more focused on systemic issues and risks, so more related to health, and there was a second set of recommendations based on data and evidence. I think together there were about 31 recommendations, and CRER worked really closely with stakeholders on all the recommendations, and we still believe that they're relevant to promoting anti-racism in Scotland. Prior to the ERG, CRER had already been campaigning on a lot of these issues, such as anti-racism in education and addressing data gaps which exist. And the immediate actions which were taken to address the public health emergency, such as providing emergency sustenance fund payments, for example, were completed at the time, and that they said within the time frame. And this ensured that many minority ethnic families received the appropriate support. But there were many actions from the ERG recommendations which are still ongoing to this day. And this includes actions such as Fair Work initiatives and the Anti-Racism in Education program. It's hard to say whether there has been strong progress on these recommendations as of yet. We as CRER still believe that there's a lot more work to be done, especially when it comes to data. Ethnicity data in health is still lacking, and it doesn't reflect a lot of the realities faced by Black and minority ethnic people. We believe that stronger recommendations could have been made through the ERG. However, there was time pressure to ensure that these recommendations could be included in the 2020 to 2021 Programme for Government. Had this not been the case, CRER believes that we could have put in more detailed recommendations with more concrete outcomes.
Thank you. Now, I want to move on to intersectional impacts and vulnerability. In paragraph 30, you mention that minority ethnic older people, disabled minority ethnic people and minority ethnic women faced intersecting barriers which worsened health and socioeconomic outcomes. Now, you've already told us a bit about the intersectionality for minority ethnic women. Could you provide us with some further detail or examples of intersectional impacts for minority ethnic older people and disabled minority ethnic people, please?
Absolutely. So for Black and minority ethnic disabled people, there was a severe gap in data. So, for example, if we try to look up now how many Black and minority ethnic disabled people were impacted by the pandemic, it would be a very big challenge. That's just to say that the information that we do have might not be a complete picture of what was happening at the time. But in England, I believe, report on the Commission on COVID-19, Ableism and Racism found that Black and minority ethnic disabled people were less likely to be added to the vulnerable list. And that chimes in with what we know about the racial empathy gap in healthcare, and that also applies to Scotland. They also reported that there were worse cases of intersectional discrimination in accessing services, another thing that CRER has done research on before. And they were also more likely to be receiving care at home opposed to being cared for at care homes. And they felt that there was little to no attention being paid to the risk for people being cared for at homes. And for BME older people, I would say a similar issue appears in the data, where a lot of the gaps means that we were not able to identify whether they were accessing services at the same level and whether there were considerations being put in place for the support that they needed, whether that was in care or whether that was in language support, for example.
Okay, thank you. So you're unable to comment on whether there were any efforts by governments or public agencies to address specific housing or support needs?
I would not be able to comment on it from the specific angle of BME,
Okay.
disabled people and older people.
Thank you. Now, at paragraph 46, you note that vaccine uptake was particularly low for Caribbean, African and Black communities, as well as Gypsy traveller communities. What were the main barriers to vaccine uptake identified, and how could these have been addressed better?
So, as we mentioned before, there are still existing barriers in access to healthcare for many adversely racialized communities. And a lot of this can be due to experience of racism that they've had with healthcare professionals and in the healthcare system. And that can deter them from using services. And that can apply when we're talking about vaccination strategies and vaccination uptake as well. Mm-hmm. Many research papers on vaccine hesitancy in the UK has identified barriers faced by specific minority ethnic communities. The Scottish Government has also produced a literature review, I believe, 2 years ago. Barriers included distrust in the healthcare systems, negative perceptions about vaccinations. I think one of the things that we can bring up was that in the past, many vaccination test trials took place in Africa and disproportionately impacted African women. And these historical injustices haven't really been addressed, and they are still very much in the memory of people, and obviously could impact vaccine hesitancy amongst Caribbean, African and Black communities.
Mm-hmm. Thank you. And more broadly than just vaccines, you say in paragraph 53 that we were aware of efforts by Public Health Scotland to ensure that public messaging was inclusive in targeting minority ethnic communities. Then you say, however, we were not able to monitor the effectiveness of this. Do you have thoughts on further steps that might be beneficial for future public health messaging?
Absolutely. So we are aware that there is ongoing work by Public Health Scotland to reduce racialized health inequalities. So in a way, this work stream is already ongoing. I think what happened at the time of the pandemic was that Public Health Scotland were trying to reach minority ethnic communities who were often excluded, and they did this through using community spaces and translating information into different languages, as we have said. But in terms of further steps, like we said before, monitoring is key, and we also feel that the use of public messaging in this instance should be continued, and they should coordinate their responses to work with third sector organisations who would be able to reassure and help Black minority ethnic communities as well.
So do you think then that working with minority ethnic organisations would allow them to better tailor public health messaging into a form that would perhaps resonate better and aid understanding and accessibility?
Absolutely. I believe that a lot of the minority ethnic organisations who were involved with vaccination strategies and also providing support overall to minority ethnic communities means that they already have a form of trust built that maybe they wouldn't have otherwise with the healthcare system, for example. Mm-hmm. And through that, they would be able to improve public messaging as well.
Thank you. Now, in paragraph 40 of your statement, you refer to the UN International Convention on the Elimination of All Forms of Racial Discrimination, and you further down state existing racial disparities continued, and there was widespread fear amongst minority ethnic individuals during this time of protest, and I think the protest refers to the Black Lives Matter movement. How did the pandemic and subsequent effects affect the realisation of human rights for BME communities in Scotland?
Human rights and equalities obviously goes hand in hand when we're talking about racial discrimination. And although I specifically mentioned the Convention for the Elimination of All Forms of Racial Discrimination in our statement, which the UK is a signatory to, we also can't forget that they also have CEDAW for women, the CRPD for disabled people, and the ICESCR for socio-economic cultural rights, I think that is. These all existed before the pandemic. And despite our now renewed increased focus on human rights, I don't think that there's actually been enough action to address racial disparities across the different spheres of life that I've just mentioned. Realization of human rights can only happen if, one, the issues are actually fully understood, and two, that there is sufficient action to address the issues. Scotland as a whole has shown that it is still susceptible to these issues raised during the pandemic. Black and minority ethnic people are still facing disadvantages in the labour market. They are still underemployed, and they're still more likely to be frontline workers. Racially motivated hate crime still makes up the largest percentage of all hate crimes in Scotland, and BME people continue to face poorer health outcomes than their white counterparts every single day. What we want to see are stronger communities being built who are actively anti-racist. And it's not enough to embed it into legislation and policy. We also need to see people who are driving the change forward. Even recently, we have seen racist rhetoric being used by political figures as part of fear-mongering. So I still think that it continues to this very day, and it's not changed since the pandemic.
Thank you. Now, you've included in your answer there, and you spoke earlier about the consequences of unaddressed structural racism. What do you think are the key lessons the inquiry should take forward regarding equality and human rights in future public health emergencies?
I think that one of the biggest lessons that need to be learned is that Black and minority ethnic communities can't continue to be sidelined. And like I said, what we've seen of the consequences is that we bear the brunt of the consequences of them. And action is needed immediately to address racism in Scotland. I think that's the key lesson to be taken away. It's not enough to say that there have been key lessons learned. We need to see this in practice, and we need to see this in action. I don't think that right now there is sufficient action taken place to address structural racism, and it's not the first time that this has happened. Warnings about research identifying susceptibilities to infectious diseases amongst particular minority ethnic groups were made in the Scottish Executive's 2002 Equality Scheme. So that was over 20 years ago. And commitments were then made to have comprehensive ethnicity monitoring through the CAI system, and that was made in 2008. And despite these known issues and racial inequalities in health, Scotland's health policy environments were still unprepared for COVID-19. Had the commitments been kept all these years ago, we might not have had to face these long delays in identifying trends and for taking appropriate action during the pandemic. Two of the lessons learned were that government needs to be highly responsive to equalities issues raised by the third sector organisations, and that once the commitments to tackle equalities are made, they must be kept. Scottish Government has to ensure that equalities and human rights are embedded in public policy. But we also need to see that it actually improves the lives of Black and minority ethnic people. As I've said before, even today, BME communities can feel unsafe. They are still more at risk of poverty. And I feel if a public health emergency were to happen today, the learnings from the COVID-19 pandemic might not be able to help them. And the inquiry should ensure that the accountability is high on the list for Scotland, and data collection also needs to be a priority.
Thank you. You mentioned a few times in your answer that urgent action needs to be taken. In your view, what are the most urgent actions that should be taken by the Scottish Government or need to be taken by the Scottish Government and public agencies? You've mentioned data collection, but other than that, what could be done now that you're referring to?
No, absolutely. Yeah, and just to go back, data collection is definitely very high on the list. Like CRER has been campaigning for years for improved data collection. And even now we can't easily access ethnicity data for things like maternal health. And without this analysis, it's hard to then take the immediate action we're also asking for. But I understand that you're also asking for other actions that could be done immediately. But anti-racism, I would say, has been a commitment of the Scottish Government and its public agencies for such a long time, and the pandemic was just an opportunity for them to stand their ground and stick to their commitments. But what we saw was a bit disappointing. Structural inequalities obviously can't be fixed overnight, so I can't give you tick box answers. We've taken a tiny step forward, I would say, in acknowledging that racism is a significant public health issue. The Cabinet Secretary for Health and Social Care only said that last year. But acknowledging is just one step. As we said before, we need action. One of the things that I can definitely point to is that even now, we're still waiting for a race equality action plan that will progress outcomes in a race equality framework for Scotland. We've been without one for 2 years. So when we ask about what's most urgent, I would say at least having an action plan would be great to say this is what we need to do next. When we're talking about data, for example, one very quick thing that they could do would be to collect data that's disaggregated for us so that we could then understand the issues properly. And what I mean by that is that BME groups a lot of the time are treated as monolithic. And we can't use that data a lot of the time. Different minority ethnic groups will face specific barriers that others do not. So, for example, when we're talking about poverty and when we categorize groups as Asian, we then lose the nuance between people from Chinese backgrounds who are faring against people from Indian backgrounds who both face a different rate of poverty.
Thank you. And finally, I wonder whether there's anything we haven't covered today that we have covered that you would like to particularly highlight.
I think the only thing I would highlight is that the needs of BME people are still not being met, which I think I've said before, but specifically I would say financially. CRER in 2022 and 23 were given funds from Comic Relief to allocate to Black and minority ethnic organisations. And while we were able to do that, and it was a great success, the demand was way higher than what we expected. And we know that these people need the support, but we're not able to provide it to them.
Thank you very much. I don't have any further questions.
Mr. Barami, thank you, Ms. Wong. That's all. And that's all for today. And we'll come back tomorrow morning at 10 o'clock. Thank you very much.
All rise.